We can hit record. Hello, everyone. Thank you so much for joining us for today's All-Com webinar on Oregon's 1115 Medicaid waiver. This is our monthly webinar in English for December 2023. And we're going to skip right over the housekeeping slide. And I am going to pass this over to our presenter for today, Megan. Hello.
Good morning, everyone. Thank you, Jessica. First of all, thank you all for being here this morning. I know it's difficult to take time out from your busy day to learn about the waiver, but I appreciate everyone finding some time to spend with us this morning. My name is Megan O'Clair. I use she, her pronouns, and I'm the project director for the 1115 waiver implementation project. So my role is to make sure that all of our work stays coordinated and you all stay updated. So I'm happy to be your presenter today. What we'll go over today in this webinar we'll give you an overview of the 1115 waiver and some of the changes that we received as a result of our recent approval or our approval from October of 2022. We'll give you an update on the climate benefit rollout, some changes to the timing of when that benefit will be available. We'll give you a bit of a preview into what's to come in 2024. So in particular, some of the engagement opportunities and topics that we plan to dive into in the coming year. And then we'll give you a bit of a preview of the evaluation approach. So when I talk through what a waiver is, I'll discuss kind of what we need to be able to demonstrate at the end of our 5-year period, and then the planning that will be imminent for the evaluation that we can expect in the next year. You'll have to forgive me, I'm getting over a cold, so I'm a little bit froggy today, but let's go ahead and move in. Okay, so we'll start with a quick overview of what is a waiver. So let's go ahead and move into sort of the key information here. So some of you may have seen this information before, but it's a pretty good primer about what we're talking about when we refer to the waiver. So every state has their own Medicaid plan that really has a set of expectations or a set of rules that are established by the federal government. When we talk about a waiver, what we're really asking for is for the federal government to waive some of those requirements. And it really entails the state asking for some permission for some flexibility to those rules, because we have either an idea that we want to test or a different approach that we want to take for the Medicaid program within our state. And really what this allows us to do is to test and implement some new and innovative thinking and approaches to how to use Medicaid funding. So this waiver goes for a 5-year period. We go through an application process where we submit it and negotiate it with CMS, which is the Centers for Medicare and Medicaid Services, every 5 years. And CMS then negotiates with us about the specific proposals that we have, and they're free to accept or reject what the state is offering to do or proposing to do. Let's go to the next slide. So Oregon has had a waiver for our Medicaid program since 1994, and this is really what allows us to offer services through coordinated care organizations or CCOs. It's what allows us to have more flexible services and availability to more individuals. And it's actually allowed us to increase the number of people that we can cover with our Medicaid program or the Oregon Health Plan. Our most recent waiver was approved in October of 2022, and this waiver will be in effect through 2027. As I mentioned at the beginning, some of our proposals we have to negotiate with CMS, and so we're still in active conversations with our federal partners on sort of the details about how the program is going to take shape. So we'll talk about that in a little bit more detail, but just know that we're still in active conversations with CMS and with our federal partners about how the waiver is going to be implemented. So the goals that we set out when we began the application process were really pretty straightforward. We wanted to make sure that this waiver addressed and advanced health equity, that as a result, we created a more equitable, culturally and linguistically responsive healthcare system. We wanted to ensure that people could maintain their healthcare coverage. We wanted to improve health outcomes by addressing what's called health-related social needs, which we'll talk about in more detail. And we also wanted to ensure that there was smart, flexible spending available for health-related social needs and health equity-related services. So we will talk about the services that we were given approval for in a little bit more detail, but these were the goals that we set out with for the waiver. So as a process of the negotiation with CMS, we were granted a number of really significant changes, some of which were the first in the country to ever be granted. So we were able to successfully extend OHP eligibility for young children, youth, and adults. And what this looks like is for children who are up to age 6, they will have continuous OHP eligibility and enrollment. Typically, a person would have to go through what's called a renewal or redetermination on a yearly basis. And we were able to negotiate having continuous coverage for children up to age 6 without the need for that renewal period to occur. We were also successful in getting 2 years of continuous enrollment for OHP members ages 6 and older. So as I mentioned, typically a person would need to go through an annual process once a year to reestablish that they meet those criteria. And what we were able to do is have that period extended for 2 years so that we had a greater time period that people could maintain their enrollment with OHP without the risk of losing coverage. We were also given some flexibilities around what's called health-related social needs supports, including some services that Medicaid has never been allowed to pay for before around housing, nutrition, and climate benefits. And then we were also able to expand coverage for young adults with special healthcare needs up to age 26. Now, all of these changes have different timeframes for their implementation, some of which have already gone into effect. So the continuous OHP eligibility is in effect currently. And the other changes that I mentioned are have a rolling timeline for when they will go into effect. So let's talk really briefly about what health-related social needs are, because again, this was a change from our previous waiver and one of those first in the nation approved benefits. So health-related social needs are really the social and economic needs that impact someone's ability to maintain their health and well-being. So it's not just access to healthcare, but it's things that it can be anything from affordable housing, utilities, the things around a person that helps them maintain a healthy living state. So this could be, as I mentioned, housing, utilities, reliable transportation, access to healthy and affordable foods, things of that nature. So within our 1115 waiver, we have different areas that are going to help address health-related social needs. Certain benefits and services that have never been covered before related to housing, nutrition, climate related devices, or outreach and engagement. And these are all really intended to, again, connect people with the services that they need outside of healthcare that do contribute to having good health. So as part of this approval from CMS, we received funding not just to cover those services, but also to cover some funding for grants for infrastructure and capacity building. So to make sure that these services are available, there's two major components here. We have $119 million that's available as grant money to support infrastructure development and capacity building for HRSN providers. So this is to ensure that there's enough capacity and funding available to support those processes for providers who maybe don't already exist as part of the Medicaid space. This is everything from staff training, technology. We know that these are services that are not already offered within the Medicaid space. So there's going to be some building that's needed to get providers into this process and into being able to deliver services for members. So that's really what that funding is intended for. And then the remainder of the funding, that $904 million over the 5-year period, this is intended to actually pay for those services. So for those eligible individuals that are able to receive the HRSN services, this is the amount of funding that will go towards paying for housing supports, nutrition supports, climate devices, and outreach and engagement. So I'll talk really quickly about what types of providers and what a provider will need to do in order to be part of this program. So I'll give you just kind of a quick overview here. First, we know that HRSN providers are going to need to work with a CCO or with our fee-for-service care coordination contractor to invoice for services and be recognized as a service provider. We're still developing some of the details around what that registration process is going to look like, and we really hope to share some additional information with you all in the very near future. Secondly, we know that these providers are going to, while they don't need to be currently enrolled as a Medicaid provider, again, as I mentioned, we'll have more details about what enrollment process or what registration process they'll need to undergo, but you don't need to currently be an enrolled Medicaid provider in order to offer these services. And then finally, we have a few other processes that are in development, including a mechanism for communication to ensure that assistance is not being duplicated by other sources. So what we mean by that is we are expected by our federal partners to use this funding not to replace a program that a person might already be eligible for, but to supplement and help fill a gap where there might not be services available for those individuals. So part of the area here that we're working on is how do we help ensure that folks can figure out if a person is in fact eligible for other programs or whether this is the right path. Additionally, some areas that are in development, figuring out the mechanisms that will verify and communicate that a referral has been received and processed by an HRSN provider. One of the things that our federal partners are asking of us is that this process look something like what's called a closed loop referral, which means that when a person is referred to a different provider, the person who did that initial referral has some idea of what happens at the end of it. So was the referral picked up? Was the person actually able to access services from that provider? Was there a barrier or a gap somewhere? So still working through the details of what that will actually look like in practice. But this is one of the areas that we're still working on. We're also determining what options there are for subcontracting. So this would be the ability of a provider to contract with another entity to perform some of the services that they're not able to provide. Again, this is something that we're still trying to work through the details of, and we hope to have more information for you in the near future. Okay, so let's go into a quick update on the climate benefits. So the update that I have for you today regarding the climate benefit, some of you may have already seen this information, but what we have decided to do is shift the timeline for the climate benefit availability from January of 2024 to March. The reason for this is as part of some of the discussions that I mentioned that we're still involved in with CMS, we have made the decision that we need a little bit more time to work through some of the operational details that are going to be needed in order to make this a successful launch. The second reason is, as part of those discussions with CMS, we were really hoping to ensure that we could expand this benefit to maybe a broader group of individuals who would be eligible for this. And it turns out we're going to need to be a little bit more restrictive in how we're determining eligibility for those services than we were originally hoping. So as part of our initial planning, we were hoping to be a little more proactive in how we were distributing devices ahead of an emergency declaration, but it sounds like we're going to need to scale that a little bit differently. So we're working through our strategy and our rollout to be more in line with what CMS is expecting to see in this benefit and in the implementation, and work through some of the contracting that's going to be needed and enrollment processes for providers. So we're really looking at this March 24 go live or launch date for the climate benefit as giving us an opportunity to work more closely with our providers and our partners to understand what are the operational barriers that you might be seeing, what are the additional supplemental materials or information that we can provide to you in this time frame to help make the process a little bit easier, and really just looking at this as a good opportunity to make sure that everyone is well informed and feels prepared for that go live in March rather than January. So in the meantime, though, there's a little bit of information that we want to share with you about how members can find additional information from their CCOs or from OHP if they're a fee-for-service member. So we have a couple of links here, and this material will be sent out to you all through the email that you provided during registration. But basically, members can go directly to their CCO to see if they might be able to be eligible for climate devices through what's called flexible services or health-related services. So there are other mechanisms that can be used to pay for similar devices prior to when this HRSN benefit will be going live. So we encourage people to reach out to their CCO and see if that might be an option for them if they're looking to get something sooner. And then if you're an OHP member and you're not sure which CCO you're enrolled in, you can always contact the Client Services Unit. There's a phone number here, 1-800-273-0557, or you can email to find out where you were enrolled and which CCO would have that information for you, and they're always happy to help. Additionally, open card OHP members can also reach out to their city or county and see if there are resources available outside of the CCO benefit or outside of the OHP benefit. Okay, let's go ahead and move into what's to come in 2024. So we want to start with some of the engagement opportunities that we are planning in the coming year. So this particular webinar has been active for a couple of months now, and we hope it's provided you with some really good information, an opportunity to share information with us. We do plan to continue these webinars into 2024. And in addition, we'll have some ongoing regularly scheduled engagements with HRSN providers to allow us to have some space for updates, discussion, and feedback. As I mentioned, we're going to continue these public webinars in English and Spanish, where we'll give you the most recent information that we have available about the benefit, about the development, and in some cases, we'll have some questions for you all about our proposals and look to get some feedback from you all. We will maintain our ongoing monthly opportunities for feedback and discussion with HRSN partners through this forum and from others. We are also in development of some opportunities for housing and nutrition service providers, in particular to focus on to participate rather in some focused work sessions. So climate is the service that we've really been focusing on over the last couple of months, given that it's the first service we were planning to go live with. And we're still in the midst of planning for housing and nutrition. So we're looking to identify some opportunities to have some really focused work sessions with providers in that area and understand kind of how our planning that we're in the midst of at the moment would affect you, get some feedback and understand where you're feeling concerned or where you'd like to learn more information. We also have some regularly distributed newsletters. If you're not already part of this mailing list, you can drop your name and your email into the chat and we're happy to collect that and add you. And we'll have some more information at the end about how to get yourself signed up for some of those distributions. And then upcoming in the new year, we're going to really focus on how to present this information in a way that's very easy to understand. So I think at this group a couple months back, we presented an example of sort of a member journey of what a member might experience if they were seeking a climate support device from their county and sort of go through a couple of scenarios that a person might experience. So we're hoping to really build out that information in multiple languages and be able to provide you all with a really good visual picture of what a day in the life of a provider is going to look like when administering this benefit. So everything from what's the expectation as far as how are you going to enroll or register as a provider, how do you get paid, what's the expectation for information that you need to share with other providers, and then what's the member experience of all this. So that's some of the work that we have upcoming and we're hoping to share with you all in the new year. I mentioned briefly some of the topics that we were hoping to discuss, but this is a little bit more detail about what those topics will consist of. So we're looking to provide an overview of the housing and nutrition benefits. So everything from what do the services consist of, what are the limitations, who is eligible for those services, and how do you determine whether they're eligible for those services. This would include housing and nutrition service definition. So something that's under development at the moment is just really more specifics on what counts as a service that could be paid for under this HRSN benefit. I mentioned the provider journey and the member journeys. We also want to be able to show those relationships and workflows between CCOs and HRSN service providers, knowing that there's a lot of organizations that maybe don't have an existing relationship with a CCO. We want to be able to depict kind of how we expect that relationship to work, what sort of information is exchanged between the two, where are you, likely to collaborate or coordinate on certain activities, and really just sort of show what the workflow is going to look like. We plan to come back and talk with you about person-centered service plans. So this is one of the requirements of the waiver, is that we document and maintain a person-centered service plan that explains what the person needs in terms of HRSN services, how they qualify, and then follow-up opportunities and where this information is stored, who's responsible for keeping it, in more detail in an upcoming session. I think I already discussed the member journey and provider journey, but this is everything from how do you determine who's eligible, what's the criteria, what information is acceptable when determining whether a person meets the criteria. And on the provider side, how do you get paid, what data do you need to submit, what are the expectations for documentation and maintaining medical records and other records. And then finally, some of the topics that we'll intend to come back with you all with more information around payment. What are the expectations for invoicing? How do you, what information needs to be submitted, and how do you get paid for rendering these services? Okay. All right. So we are moving right along into our next topic. Let me pause real quick and check in with Jessica and see if we have any questions that we need to be addressing urgently.
I think since evaluation is a pretty different topic, we did have, we had a few people who were wondering about a little more information about people who are not on a CCO. And I think this was back when we were talking about the rollout of climate services, and if there's any additional guidance to expect there.
Let's scroll through here. Yeah, I see the question about who's going to be coordinating services in place of the CCO for fee-for-service. So right now we're in the process of actually determining who the which organization we're going to be working with to coordinate those services. So we'll have more information in the coming weeks about what who will actually be performing that work, contact information, and so forth. So I don't have a lot of information to share about who is going to be doing that work at present, because we're in the midst of some conversations and negotiations, but we will have some contact information and more details about how the fee-for-service side of this is going to operate.
Thank you, Megan. And then we have interest in participating in the work sessions.
Okay.
And then the most recent question is around where will community members find information about the HRSN grantees once they are identified and or awarded?
That's a good question. I believe we're intending to have the CCOs publish some information around who's been awarded, but I would need to check back with the team about how we're planning on publishing that information. So let me plan to connect with our team and get back with you on how that information will be made available.
Thank you. And then I think as far as participating in various engagement opportunities, there are different answers depending on like where you work or what you are doing and what the different opportunities are. So I might take that offline to inquire for a little more details so we can see how to connect people in the right places. But if you are interested in participating in more ongoing work sessions or other opportunities, the short answer is talk to me and we can figure it out. So I hope that helps.
All right, I'll move into evaluation. Alrighty, so as I mentioned at the beginning when we talked about what a waiver is, I talked about how this was really an opportunity for states to try out new ideas and really kind of test a theory. It's called a demonstration waiver because what we're looking to do is demonstrate that the thing we think will happen, in fact, does happen as a result of having these additional flexibilities. So as one of the requirements of our waiver, we have an evaluation that's going to be at the middle point of the evaluation period, which is a 5-year period from 2022 to 2027. And then we have an evaluation that occurs at the very end of the waiver. So as I said, these are an opportunity for states to test and implement some new innovations using Medicaid funding. A couple of key things to know about our evaluation. So the state doesn't actually perform the evaluation itself. This is conducted by an outside independent party. The idea being that the state will help support the design of the evaluation, but we don't actually measure our own performance. This is done by someone else. And what we have done is we've contracted with an independent team based in Portland within Providence called CORE. This will be our contractor for developing the evaluation design for the 22 to 27 waiver. And a couple of key things to know about our evaluation. So as I mentioned earlier, we go into the application sort of proposing some approach to CMS, and they make some decisions and negotiate with us about which proposals they are willing to accept. They also have a good idea at the federal level of what they would like to see in terms of an evaluation. So they want to make sure that we're actually measuring the right things. And so what this ends up looking like is a combination of inputs from the federal level about what they want to see in an evaluation design, and then our goals at the state level about what we're hoping to show through the course of this demonstration. So let's go ahead and shift to the next slide. So the first step of this is really building the evaluation design. So this is going to happen over the next couple of months. Again, this is a combination of what CMS provides to us in terms of their goals and evaluation questions they're expecting all states to abide by. So there are other states with 1115 waivers. They don't all have the same goals, but you will see the expectation from our federal partners is that they're going to tell us what types of criteria they would like to see in an evaluation design. So what we do is we take the contributions from CMS, which is our starting point, and then OHA and CORE invite some interested parties to participate in this evaluation design process. And the expectation is that they're going to contribute some additional questions or priority issues that we should be considering. They might give some guidance or suggestions about how to address both the CMS questions and CMS expectations and the Oregon specific questions, and then participate in interpreting and using the evaluation findings over the course of the waiver. So what we're trying to do here is build something that shows our federal partners what they're hoping to see in the demonstration, and in our evaluation of the demonstration, we want to include elements that are very unique to Oregon and unique to the waiver and our Oregon Health Plan program that maybe don't exist anywhere else in the country. We will talk through how those questions are going to be examined and how we're going to use them to demonstrate the goals of the waiver and include that input on how the findings will be interpreted. And then we come up with an evaluation design. This is what we will eventually submit to our CMS partners with the expectation or hope that they will approve our evaluation design and move forward into determining what specific measures and what data we'll be collecting. Let's talk a little bit about the timeline for this evaluation design planning. In the next couple of months, we will be asking for input from interested parties on evaluation questions and priorities. So this will occur from December of 2023 through February of 2024. At this point, we're asking for input on a wide range of interested parties on what things the evaluation should address. So what kinds of questions would you like to have answered about how the waiver is going so far, what effects it will have, and we'll talk a little bit later about how to submit suggestions, but this is really what we're focused on at this stage of the evaluation design planning. Roughly at the end of February, we're hoping to have a draft evaluation design to share for feedback and refinement. So we're going to take that input, come up with a proposal, and then plan to share that at the end of February and just get some additional feedback on whether these are the right questions, whether these are the right areas to focus on. And then we'll have our first draft of the evaluation design. So even once the evaluation design has been submitted to CMS, we will still continue to work with those interested parties to identify the opportunities for you all to stay involved in the waiver evaluation, things like helping to interpret and use evaluation findings, or identify some spaces where we can make some course corrections in the evaluation plans over the course of the waiver. We will go into the updated design evaluation draft that's submitted to CMS at the end of April. And then we're expecting to receive feedback from CMS after that point, which will have then 60 days to submit some revised design plans. As you can see, there's a lot of back and forth between the state and our federal partners. And the idea here is, again, we want to meet the minimum requirements from CMS, but also make sure that this reflects the specific and unique characteristics of the waiver and of the Oregon Health Plan. And that what we end up with at the end is an evaluation design, evaluation plan that really reflects the unique nature of Oregon's waiver and Oregon's program. All right, so I mentioned earlier that we have some opportunities here for you all to offer suggestions and provide input. So we are hoping to hear from you at this stage, and this will all go into informing that initial design period. So some ways that you can do that, we've got an email here at the bottom, which is or1115waivereval@providence.org. Some of the example questions that you might be able to provide some input on: what do you hope to learn about the implementation or impact of the new waiver policies? What changes or challenges are you seeing for waiver policies that are already in place? For example, continuous eligibility. How can waiver evaluation contribute to advancing health equity in Oregon? Or really any other ideas or suggestions that you have for how we might approach the evaluation design. Please feel free to send those to the email address that's on the slide. And again, we'll have this material sent out to everyone who's registered. All right, so let me pause there. And I think, Jessica, I hand it back to you to help manage our question and answer period.
Sounds good. And actually, could we go back one slide for a second? Because I want to point out that the email for the evaluation suggestions and questions is different than the one that we share for almost all of our other waiver related usage. So you'll see that it is OR1115waivereval@providence.org. So I know it went by a little quickly, and I wanted to just call your attention there. If you do send something to us at the state that you want involved in the evaluation, we can send it along, but I don't want us to accidentally end up in the middle, or I just want to make it really clear that that is a different group of people and a different email than what we share for our other aspects of this work. So with that said, yes, happy to circle back to question and answer, and we have a few that have come in. I don't think we have any that relate to evaluation, but if you have any questions around evaluation, please feel free to raise your hand or to put something in the chat or Q&A as well. Let's see, getting back to where we stopped off before the evaluation conversation. I believe you said this, Megan, but maybe you can reiterate that third party who for open card fee for service members, that is information that will soon be available, but is not yet final. Correct. Is that correct? Okay.
Yep. We're still in the middle of negotiations at the moment, so as soon as we have that to release, we will.
And then we do have a question that goes back to the climate benefits update, and if we can clarify the impact of the CMS position on the emergency for that, if that.
Yeah, happy to. I don't see anyone from the climate team joining us today, but the brief answer is that we were hoping that we would be able to be a little more proactive in identifying members to distribute devices to ahead of when an emergency would be declared. So part of what we had negotiated with CMS was that members would be able to receive devices when a state of emergency existed that was either declared by the state or federal government. And what we've had to do is kind of go back to what we were originally expecting, which was that the declaration does have to be in place in order to sort of trigger that eligibility. So we're not able to do as much pre-positioning or preventive activity there. So it does scale down the number of people who would be eligible to receive those benefits. So the impact would be a smaller volume of people who would be able to receive climate devices under that criteria.
Thank you. And then we do have a question about some clarity around becoming an HRSN provider. And we had a slide here that said that becoming enrolled as a Medicaid provider was not required, but wanted some clarity on that. And also about if it's required or expectations for being able to access those capacity building funds. If there's any more clarity on that process of enrollment or becoming an HRSN provider and where those lines are.
Yeah, so let me tackle the first question. So what we had said in the earlier slide was that you don't need to be a currently enrolled Medicaid provider in order to participate in the HRSN benefit. We're still trying to work through the details of what the requirements will be for a provider to register. So that's something that I'm hoping to have more information for you in the coming weeks. That includes the process for any sort of registration that will be needed, what information will be required to submit. And at the same time, we're also hoping to have clarity for you all on what eligibility or what a provider would need to do in order to be eligible to receive the capacity building funds. So that's a future topic. We're still working out some details there and trying to understand the best path forward. Ultimately, we want to make this as easy to participate in as possible. The challenge is that anytime we're dealing with funding that comes from our federal partners, there are some restrictions that they place on which providers can and cannot participate, and there's some information that they want to see just to understand sort of what's the provider network look like. So at the moment, we're trying to balance those two things of making it easy to participate and also meeting the expectations of our federal partners. And so I'm hoping to have sort of some final decisions from our internal folks in the coming weeks on what the expectations will be for providers.
Thank you so much. And then a related question is if we could talk a little bit more about the timeline for those community capacity building funds and when that funding will be released. I'm not sure if we had a slide that had that information explicitly on it this time around.
I don't think we did. At the risk of giving you an answer that might be inaccurate, I want to say that the first window for community capacity building funds has, I think, June or July of next year as the when the funding would actually be released to the providers or to the CCOs to then give to the providers. I would like to come back with more detail on CCBF, but I think we did tackle this in a prior webinar, so it might be worth just dropping the link in for some of those previous discussions, because I know that there's going to be more detail on there. But off the top of my head, that's the time frame that I'm recalling. So hopefully, if there's someone on who can correct me if I'm wrong, otherwise we can definitely send out the link for the session that covered the CCBF funding.
Thank you. And then we have a question about, do we anticipate the timeline for other HRSN services to be delayed in the same way that climate has been?
At the moment, we're not anticipating other delays. I think we're trying to get implementation planning lined up as quickly as we can, and knowing that we're still in discussions with CMS on a couple of those provisions. We just needed a little bit more time to make sure we get the details worked out. But at this time, we're not anticipating an impact to the other launch dates.
Pardon my delay as I read. There's a lot of great stuff in here. Let's see. Will information be given by district of who the HRSN providers will be and how to connect with them? And so I think that's regional questions about how people can find out where the network is.
That I do not know, but let's put that on the list to follow up with the team. I'm not sure how soon we'll have information like that. This seems more something that we would probably be likely to have more towards the second quarter of next year. But it's a good question, and we'll make sure that we've got some follow-up for you on how you can find information about who an HRSN provider would be.
And then I think this is a really good question around the difference between health-related services and health-related social needs services as it is written into being housing, nutrition, climate benefits, outreach, and engagement. And sorry, I'm speaking at length on this instead of just reading the question, because I think it is really important to say out loud that there are many health-related social needs that people have and many ways in which to help people with their health-related social needs. And there are very specific ways in which we have the go-ahead in this round of the waiver. And so we have very specific populations, very specific types of services and supports that we are able to offer in this round, but that there are many other needs people have. There are many other programs and pathways that people can get support. And so I see here HRS covering things like clothing or driver's license fees. And that is a really big difference between the two programs, is they are built very differently and can do different things. And now that I have talked around it a lot, I'm wondering, Megan, if there's anything you want to add about what we are able to do versus where we have the limitations on HRSN.
Yeah, let me see if I can tackle this. So I think Jessica's description was exactly correct. So these are two separate programs. HRSN is more limited and more prescriptive than HRS. So I think this topic has come up in a couple of different forums, and I think would be worth maybe setting aside time in this forum to go through in more detail. But yes, health-related social needs services are limited to the specific services that CMS has approved. They're being treated more like covered benefits, so defined by the federal government, whereas health-related services are more broad. The CCOs are able to define kind of what a lot more of what those benefits consist of, and they're a lot more flexible. But I'll note this down that I think this would be worth digging into with the team in more detail, and perhaps could be an item on an upcoming webinar session.
Great idea. And then we have a question about other engagement sessions or opportunities to be involved in policy development or in how HRSN benefits will be structured.
Let's see. So I mentioned before that we've got some plans to pull together providers in, maybe some focused conversations around housing and nutrition. I think I'd probably be curious to know a little more about what the question is referring to about how the benefits will be structured. So what we're in the process of doing right now is things like getting more specific about service descriptions. So what services will be covered under the approved benefits, what providers will need to do in terms of reporting, showing that people meet the criteria, what types of circumstances in which they'd have to exchange data. So happy to answer more questions if you've got a specific one related to how HRSN benefits will be structured. But those are the areas that we're working on developing the program design for. But there will be other engagement sessions and other opportunities where we'll bring to you sort of what we're working on, and would want to understand how the proposals that we're putting forward impact you. And that feedback will then inform sort of what our final decisions end up being. So yes, there will be other engagement sessions planned. And at the point that we send slides out, there's a few different examples of where those engagement sessions will be focusing and how to get involved.
And to bring it back to some of the intro information that we give a lot, because we want to make sure people are on the same page, I just want to also call out that this is a 5-year process, and we're not that far from starting the next process by which we figure out where we're going next. So it's a never-ending set of opportunities, and at different stages, we have different ways in which we can think really big or get really focused. And so there will be whatever comes next as well. So I wanted to call that out. I do have a question that came in through the Q&A around any information we can give about health information exchange or community information exchange or IT systems that are being identified when it comes to referrals for HRSN.
Yeah, I don't know how much more information I would be able to provide there. I know we are in the process of determining where CIE could help meet some of the requirements here, especially around closed loop referral. But I'm not sure if I've got anyone on currently from the CIE team who can speak to that. So I'm a little reluctant to answer a question on their behalf.
Sounds like another good future topic to dive into a little more.
Agreed.
Oh, this is the part where I know just enough to be dangerous. The definition of an institution for mental disease, I know is a specific codified thing. And we have a question about that, what that definition is.
Yeah, that's another one I'm not going to try and tackle off the cuff, but I know that that is probably in OAR in an administrative rule.
I want to say it has something to do with the number of beds, also the definition between this and other entities that are similar, but I'm not going to try to answer that.
I think this relates specifically to facilities that a person would be released from to be eligible as a transition population.
Mm-hmm. We'll get back to you. And I see another question in our Q&A. Pardon me, I want to make sure I understand it. I'm just going to read it as it is because I don't want to get it wrong. It is difficult for CCOs to conduct outreach and engagement with community partners without parameters about what will be required to participate in this provider network. Also difficult to know what types of capacity building and resources community-based organizations will need to move in this direction until the direction is clear. Do you anticipate these questions will be answered before applications open for the capacity building funds?
I think that's a question I'll be happy to take back to our capacity building funds team. But of course, we will expect to have a lot more clarity on what will be expected for CCOs and for providers in applying for those that funding, and what would be eligible and what we'd expect to see in terms of awarded applicants. So let me take that back to the team and see when we can expect to have more information for you.
And my question to you all is, did I miss any of your questions, comments? Is there anything else that in our last couple of minutes we want to make sure we cover today? I think I have read them. I may have paraphrased some of them, and you can also let me know if I did not do that justice. But yeah, it's a good segue into also, this is not your only opportunity to work with us, to speak with us. And so a few opportunities we want to point out to you are that we do continue to have our 1115 waiver.renewal inbox. If you have any questions or you are seeking any information, we also are continuing to update our website with waiver renewal information. And Megan called out that newsletter opportunity, so there's a link to that as well. And you also have the humans here in this virtual room who you can reach out to. And I know I put some information in the chat for people who are potentially seeing themselves in that HRSN partner or provider role and want to learn more about those engagement opportunities that are coming up. So please feel free to reach out to me. And I do see that someone has put in a definition from OAR for the for IMD. And I'm going to read that out loud really quickly. Institutions of mental disease, or IMD, means a hospital, nursing facility, or other institution of more than 16 beds that is primarily engaged in providing diagnosis, treatment, or care of individuals with mental diseases, which includes substance use disorders or SUDs. And then I think in closing also, if you put something into the chat or the Q&A box, then we do have record of it. We really appreciate you all spending time with us monthly and in any of the other places where you're interacting with either waiver staff, OHA staff, other state staff, or one another on a regional level. And we are very thankful that you are actively participating and partnering with us on this. And we're always open to hear about how we can be better partners and better collaborators. Thank you all so much. Thank you, Megan, so much for your presentation and for everyone else in the room who has been helping out on the back end.
Thank you, Jessica. Thanks, everyone.
Thank you all.